Coming back to the human tissue, different tissue contains different amounts of hydrogen nuclei. For example, cancerous tissues are areas of rapidly growing and dividing cells. This increased cellular activity is accompanied by increased blood flow to the tissue and increased water content in the cells. As a result, a T2 weighted image will show cancerous tissue as an area of unusually high brightness. Image contrasts are used to produce different types of images. On a T1 weighted image, white matter appears white and gray matter appears gray, while cerebrospinal fluid, or CSF, appears dark.
On the left-hand side of the screen, we have a T2 weighted brain image, and linked to that on the right is a T1 weighted FLAIR. So as we scroll through the images coming up from the post fossa here, we come up through the cerebellum. Now, as you can see, we can see bright signal, CSF on the left, that's a T2 weighted image, which is a long T, long TR, whereas the fourth ventricle on the right sided image, which is the T1 weighted, it is dark. There's no signal coming back from the CSF. This is the orbits, obviously. There's a lot of fluid in the orbit, so it's bright signal on T2 and dark on T1. And as we move up through the brain, again we can see that there's quite a lot of bright signal in the image on the left. Ventricles again are bright and dark on the T1 weighted image on the right.
A contrast agent is often used to improve the image. Water can be taken orally for imaging the stomach and small intestine. More commonly, a paramagnetic contrast agent is given. Gadolinium is a common example.
Certainly any tumour work involves a contrast injection, because tumour sites will take up the gadolinium, and that will show as an area of increased signal on a T1 weighted post-gadolinium image. If we're using that in the brain, then we will usually take two sequences post-gadolinium to look at it in two planes. After gadolinium is given, we will always use a T1 weighting to acquire the post-contrast images.
The MRI has many advantages over other diagnostic imaging techniques. MRI systems do not use ionizing radiation and therefore have a very low incidence of side effects.
MR has great contrast, tissue contrast. It has pretty good spatial resolution. It can be acquired in three planes, three orthogonal planes, but multiple planes of obliquity. Because of the nature of MR, each different tissue is assigned its own shade on the grayscale. So therefore, the contrast that's available, the contrast to noise ratio and the signal to noise ratio, which we can now achieve with a lot of these coils, is really superb in comparison to something like CT, where things are basically black or white.
However, it is an expensive procedure and unsafe for people with pacemakers.
First thing is the safety issue. They need to fill out a safety questionnaire and listing all their previous surgery, whether they've had any kind of implants or metallic devices or anything like that. So that's a big issue. If they've had any of those kind of things, we have to check whether or not they're compatible with the magnetic field. Some of them are, some of them aren't. Some will be a patient safety issue in terms of heating, or some devices will move if they're not implanted into bone or muscle tissue or have any fibrous tissue around them. Other things are just things like knee implants or bone implants, and most of the time they'll be okay, but we need to know about them. They'll cause some artefact on the images, but they won't necessarily impair the whole examination. There's the issue of claustrophobia, because as you can see, the magnet tunnel is quite small at 600 diameter. There are some quite large patients that are unable to fit into the magnet system, which can be a problem. Many people will do things like cross or uncross their legs or move their arms around and not realise that has the capacity to move their body enough. Movement is the real enemy of MRI because of the way that the case-based data is acquired. In a CT, if you move, you might ruin one image, but with the way the data is acquired on MR, if you move, then that may translate through a whole packet of images.